Hello everyone, this is Dr. Priyanka Agarwal here. So we are starting with our chapter 1 of Pharma, that is Introduction and Routes of Drug Administration. So from this chapter you can see the list of important questions here. In this video we will cover only introduction, and in the next video we will see the routes of drug administration. So from this part, that is introduction, we have only one question, important question, that is the sources of drug with example. So we are moving on to that. So before that we will see some really basic things about pharma. So what pharma is about? Pharma is about science of drugs. So what is drug? What drug will be? Any chemical substance which produce biological response. For example, paracetamol, it is a drug because it is decreasing fever. It is acting on the human body or living system, and decrease in fever will be the biological response. Okay. So pharmacology include all aspects of knowledge about drugs. So what do we study about the drug? We study everything about drug, but being very focused on the effective and safe use of drug for medical purpose. Okay. So now coming to dental practice, we generally get question like why do we have to study all the systems like CNS, CVS, GIT? Why do we need to study all those? So to get the answer, we have to imagine ourselves in a clinical setup. So first we need understanding of drugs to prescribe drugs for treatment of dental conditions. Next, whenever we are working on the patient, there can be some medical emergencies like hypoglycemia, angina during the procedure. Okay, so to deal with such situations also we need to have good understanding of all the systems. Next, patient who is visiting to the dental clinic can have already some medical conditions like diabetes, hypertension. So the drugs taken by the patient can have some dental implications, or the drugs can also interact with the drugs prescribed by the dentist. So broad understanding of pharma with emphasis on certain aspects is needed. Okay, so this is about what we need as a dental practitioner from pharma. Okay, so moving from this, we are going to what are the two main divisions of pharmacology. So two main divisions of pharmacology are pharmacokinetics and pharmacodynamics. So pharmacokinetics is the kinetics of the drug. That means movement of drug from and through the body and coming out of the body. Okay, so it is what body does to the drug. Okay, so remember it like KB. So kinetics and body. So if you remember this one word body, you will be able to write this sentence. So pharmacokinetic is starting with body. So what body does to the drug. So it includes absorption, distribution, biotransformation, that is nothing but metabolism of the drug, and excretion. Next, pharmacodynamics. So dynamics, remember it like DD. So dynamics, the sentence is starting with D. So what drug does to the body. So when the drug is inside the body, what it is doing. So it is nothing but the mechanism of drug action and drug effect. So it will include these two. So this is about pharmacokinetics and pharmacodynamics. Now after this we will also see drug nomenclature here. Okay, so whenever we are studying some drug, we have to understand that it can have three category of names. It will have chemical name, non-proprietary name, and proprietary name. Coming to chemical name. So chemical name is name that describe the drug chemically. Okay, so that describe the drug chemically. For example, N4-hydroxyphenyl acetamide is the chemical name for paracetamol. Okay, so you can see that here in this structure. So this is the chemical structure and the chemical name of the drug. Okay, so this is not suitable for prescribing. That makes sense, right? So we cannot remember this chemical name for prescribing. So this is not suitable for prescribing. Now coming to non-proprietary name. So non-proprietary name, it is the name accepted by competent scientific body or authority, like United States adopted names and British approved names. So USAN and BAN. Okay, so example would be paracetamol. So you can see that here for the same structure, non-proprietary name would be paracetamol. Okay, so this is uniform internationally and synonymous with generic name. So when we say generic name, it is nothing but the non-proprietary name, and it is suitable for prescribing. Next, coming to proprietary name, so remember it like proprietary. So it is the property, okay, property of someone. So it is the name assigned by the manufacturer and it is his property or trademark. So it is designed to be short, catchy and easy to remember. For example, Dolo 650 for paracetamol. So this is very common drug use. So this is nothing but Dolo. This is the proprietary name. Okay, this is the proprietary name for paracetamol. Okay, so as we already know, one drug can have multiple brand names. Okay, so for from different manufacturers in different countries and for combined formulations. So we can see here same paracetamol can have the brand names as Dolo 650 and Brixodol 650. Okay, right. So having this multiple names for the same drug lead to confusion and argument for using prescribing. But when quality and bioavailability of the drug has to be ensured, it is better to prescribe brand names. Okay, so this is about the drug nomenclature. So we have chemical name, non-proprietary name and proprietary name, that is nothing but the brand name. Okay, now we are moving on to our question, that is the sources of drug. So whenever we are studying any drug, so first question that comes to our mind is from where are we getting this drug? So drugs can be obtained from variety of sources. First is plant. It can be animals, microbes, minerals, synthetic and biotechnology. So we will go to each one as we go ahead. So coming to the plants, so it is the oldest source of drugs. Okay, and chemically, drugs from the plant origin will be falling into some categories like this. So here we have first as alkaloids. So what are alkaloids? Alkaloids are alkaline nitrogenous bases. So you can see here in the structure, so we have some nitrogen in the structure. So they are the nitrogenous bases. So these form the most important category of plant origin. Some examples would be morphine and atropine. So we are familiar with some of the drugs here like caffeine. The tea what we drink on daily basis is nothing but alkaloid. Okay, so the caffeine, morphine and atropine. Now coming to glycoside. So what is glycoside? So from the name we understand glyco means something related to sugar. Okay, so it is consisting of one non-sugar moiety linked to sugar moiety by the ether linkage. So you can see that from like here in this image. So this is glycon part, that is the sugar moiety. This is non-sugar moiety linked by an ether linkage. Okay, so this is about glycoside. Now example would be cardiac glycoside. Same thing here, glycoside and senna. So this senna is commonly used as a household remedy for constipation. So this is leaves, senna leaves, and they are stimulant purgative. They are nothing but anti-constipation drugs. Now coming to oils. So what are oils? Oils are viscous inflammable liquid. Okay, so they are insoluble in water. Okay, so there are two categories here. We have fixed oils and we have essential oils. Fixed oils means what we use in cooking. Okay, so they are non-volatile, means they do not vaporize. Okay, being volatile means they do not vaporize here, and they are calorie yielding, and that's how they are used for food and emollient. So what do you mean by this emollient? So emollient is something, you can see that here, emollient is something that softens the skin. Okay, so when it acts as moisturizer for the skin. So we generally use as coconut oil and sesame oil as a moisturizer, right? So that is the emollient. Now essential oils, so they are volatile, means they vaporize, and they are aromatic, means they have good smell. So they are volatile aromatic oils. They do not have any food value, but they are used as flavoring agents, counter irritants and astringents. Now what do you mean by this counter irritants and astringents? Counter irritant is something very interesting about the drugs. So how they act is they create irritation or mild inflammation in one location with the aim of relieving irritation in another location. Okay, that means if we have some burning sensation at one location, if we apply this counter irritant at other location, our mind shift to that new area where we applied the drug. Okay, so that's how it is decreasing the sensation of the drugs. So okay, so what do you mean by astringents? Astringents are nothing but some some drugs have this astringent property. So what do you mean by this astringent property is they are the substances which precipitate the proteins. Okay, so what is the meaning of precipitation of proteins? That means from the solution they separate the proteins. So when we apply such drugs to the skin, they precipitate the proteins from the surface and make the cells shrink. Because of that, the surface will become hard and it will protect the skin and reduce bleeding from the minor abrasions. So that's how they can be used. So essential oils, they do not have any food values. They are used as flavoring agents, counter irritant and astringents. Okay, so these are the examples: eucalyptus oil, nilgiri oil, peppermint oil, clove oil, camphor, menthol and thymol. So we generally use this in our day-to-day life. Clove oil for the dental pain, and this will be the menthol. Okay, now we are moving on to next category, that is others. So here we have tannins, gums, glycerin. So tannins is nothing but some drugs what we get from the plants like Arjuna, Ashoka. You might have heard these names. Okay, so they also have these astringent properties. So we just now understood what do you mean by astringent. Okay, next comes to the gums. Gums will be the suspending agent for liquid dosage form. Okay, so these are the gums what we get from the plants. Okay, so they are the liquid dosage form. They are the suspending agent for liquid dosage form. Now we have glycerin. So it is a plant based liquid which is a sweet liquid used as a vehicle for throat and gum pain. Okay, now coming to the next source. So we are done with the plants. So in the plants we have alkaloids, glycosides, oils and others. Now coming to the animals. So animal products can be used as drugs like adrenaline, thyroxine, insulin, liver extracts. For liver extracts generally vitamin B12 and few vaccines can be used as drugs. Next is microbes. So microbes like fungi, actinomycetes, bacteria, they generally give our most of the antibiotics like penicillin and gentamicin. Okay, so this is something very interesting here. So how did we get our penicillin? So they say it is an accidental discovery of penicillin. So our scientist, that is Alexander, he forgot to clean the petri dishes before going to the vacation. So when he came back, he saw bacteria growing everywhere except at the locations where we have our fungi growing. Okay, so this round thing here is the fungi. So then he came to the conclusion that okay, fungi has something that is stopping the bacteria to grow. So that's how we got our antibiotic penicillin. Okay, so from the fungus we extract our drug. Okay, so next, bacteria like streptococci, it is giving the enzyme like streptokinase. So streptokinase is something that is that it break down the clots and it help in the myocardial infarction cases. Okay, now microbes also help to form some vaccines. Okay, next coming to minerals. So some mineral salts are used as drugs, like example is iron salts, calcium salts, iodine. So they are used as drugs. Now come to synthetic. Synthetic means they are made in laboratory. Okay, so this is the largest source of drugs now. So here by this lab made drugs we can make like target and action specific biomolecules are synthesized. For example, for this target specific is AC inhibitors, HIV reverse transcriptase inhibitors. Okay, you can write this as examples. Action specific is atropine sulfate. Now coming to biotechnology. So these are here the drugs are produced by recombinant DNA technology. Example would be human growth hormone and human insulin. So if you see here, what is recombinant DNA technology? So we take human cell, okay, from the cell, from the nucleus, we extract the part of the gene or gene that is coding for example, insulin. Okay, so we take out the insulin gene, we insert this gene into the bacterial genome, and then this recombinant DNA is inserted into the bacteria, and now the bacteria is forming insulin, okay, by protein synthesis. So this is nothing but recombinant DNA technology, and by this technology we are making some drugs like human growth hormone and human insulin. Okay, so this is the sources of drug. So first we read about the plants, then we read about animals, then we read about microbes, minerals, synthetic and biotechnology. Okay, So this is about the first question here, sources of drug. So in our next video we will cover routes of drug administration, and all these questions will be covered. Okay, so this is all about introduction to pharmacology.